Good morning, everybody, and welcome to this third day of ISEF. At the outset, I'm extremely grateful to Chaudhary Garu for giving me this opportunity, creating such an environment here, which I think is very unique. And like we were talking before, as he said, I think startups in healthcare are going to the future of this country. And I think we have an extremely bright future looking at the quality of, say, doctors, engineers that come together in our country. In medical healthcare process, I think the most important area is going to be artificial intelligence. Artificial intelligence doesn't require a big capital to develop. I think artificial intelligence is something that's going to revolutionize medicine all over the world and is going to create not only many startups, but is going to completely change the way we practice medicine. I am a gastroenterologist. I'm practicing in a hospital called the AIG Hospitals nearby in Gachibowli. And I should start first with a disclosure that I'm not an AI expert, nor do I process the coding knowledge. I'm very basic in this. But I use, for example, ChatGPT for daily medical practice now, and I'll show you some examples. And of course, we're using AI extensively in the type of research that we are doing. In healthcare, the patient care, if you actually look at traditionally what happens, this is a very old painting of an English doctor in 1854 looking at the patient. This doctor doesn't have any imaging techniques, doesn't have magic pills, doesn't have any CT scans and so on. Yet, the way he's empathetically looking at the patient made this painter draw this very famous painting called The Doctor. In medicine, we are taught for many, many years it's clinical examination, investigation, interpretation, and treatment that actually result in what benefits the patient. We are told very little about artificial intelligence and so on. I see Ravi here. Ravindranath is one of the leading gastrointestinal surgeons in the country today, so I'm glad he's here also. So this is what medicine is. Medicine is on-site medicine, empathy, and a natural intelligence. Artificial intelligence has extremely small role to play as we used to think a few years back in this area. In fact, I was a total disbeliever in AI till recently, and I'm now a total convert, and I'll show you why. Again, this for the engineers is a very basic knowledge how artificial intelligence. Alan Turing in UK during the World War developed this technique, which next for 20 years went into hibernation, the winter of artificial intelligence. And 1970s came machine learning, and little later, of course, came the deep learning or the CNN technique that we use. So central to machine learning and deep learning, there's a periphery of several things that are happening for doctors. And again, for me and surgeons like Ravi, it's a computer vision, which is actually looking at the lesion, giving us the diagnosis, image recognition, saying it's a cancer, not a cancer, and so on. We also use natural language processing, and of course, we have natural language generation, LLMs, and so on. All these are in the periphery. Put together, artificial intelligence is going to make a huge difference in how we are going to actually change again in medicine, where all is artificial intelligence being used. And I actually went to ChatGPT yesterday and put this, can you tell me where all AI can be used, because I'm going to face a large group of very intelligent engineers. I have to know exactly. And it gave up these options. It's going to be diagnostic and image analysis, which is already being done, in drug discovery, where it's already being used, in personalized medicine, in predictive analysis. So you take a group of tests and say that this patient is likely to develop a cancer or this or that. So it's predictive. It's getting into robotics. We've already developed at AIG a virtual health assistant called Mira, which can answer questions of the patients, and so doctors don't get bugged by regular questions. And of course, it's playing a role in wearable health devices and in clinical decision support systems. So these are all the uses of artificial intelligence. So at present, most of the research is focused on radiology, on looking at the images and saying whether you're dealing with, say, cancer which can be missed by a natural eye. So basically in imaging, disease diagnosis and telehealth and so on. I'll show you some of the examples here. And it's believed that AI will have impact at 3 levels. For the clinician, as a doctor, I want rapid, accurate image interpretation and diagnosis. We want the health systems to improve efficacy. And of course, we want to promote personal health by a patient processes his own data. And this I'll come to some of these that's happening here. So people, I think doctors at some stage are worried, will AI completely replace them so that they lose their jobs? The answer is no, AI won't replace the doctor, but it will definitely be somebody empowered with AI who will replace a normal doctor. So an AI-empowered doctor in a few years is going to replace a normal doctor who doesn't know anything about AI. So let's look at these 4 areas where I believe AI is going to play a role. First is the health services management. This is an important area that AI is going to play a role. For example, again, this is something that Ravi knows. He's been running large hospitals. Organizational operational efficiency can be markedly increased. I'll tell you an example in a hospital what happened. Patients were coming for surgery, and when they're coming for surgery, the surgeon sees them and says, before surgery, we call what is called a PSC, preoperative checkup. You go to ECG, go to the cardiologist, go to the echo, go here and get all these tests done, get everything together to go to a physician who will certify it's safe to do surgery. When we did an AI calculation of patients who are coming to us for this, we found that they were taking approximately 17 stations, different stations. And our AI engineers drew what is called the spaghetti diagram of how these patients were touching different points. Because of this, many patients get discouraged, and we had a 20 to 30% dropout for surgeries. Patient will come, get everything done, and doesn't come for surgery because it's getting exhausted by the time all this is done. So we went into AI. So AI calculated this is the time, this is the number of areas that your patient is sending. So we went to ChatGPT for an answer, and the answer was simple. The answer was, get all these services into one area. So we created a single tower of PSC. So patient comes in the morning, in about 2-3 hours time, has a nice experience, sits and finishes all the tests, has a cup of coffee. We are going to introduce Araku coffee there now. Has a cup of coffee and then goes back. And now we found that the take-up for surgery is 99%. So from 80% is come to 99%. So you see the simple way of how operations can be helped by AI. So this is, so many other things, supply chain optimization, integration of care across providers, all this can be done by AI. Yeah. Of course, our administrative decisions can be enhanced. And the other important thing we found is patient engagement. What happens is a busy doctor is seeing about, say, 50 to 100 patients a day. And sometimes the patients come up with very, questions which to the doctor look very silly, but for the patient is important. Now he comes after surgery and says, I'm passing 2 or 3 stools, what should I do? So what we have now created is an AI assistant. Actually, it's a bot assistant. We call it the Mira bot of AIG, who's on a big screen there looking very humanoid and answering questions. When the patient asks questions, it's fed with all the data and comes up with the answers. And the patients are extremely satisfied with this, that they don't actually have to every time catch a doctor to get an example. So I think this is another example of how in healthcare management. Now coming to predictive medicine, this is going to be the future of medicine, how AI is going to be used. In fact, this is an area where early disease diagnosis is going to become very important, and we can stratify the risk. We just actually went into an arrangement with Leroy Hood, one of the biggest predictive medicine experts in the world. In Seattle, along with Bill Gates, is established predictive medicine institute called System Biology Institute. So what we have done is we have taken serum samples, blood samples of patients coming with different diseases, a particular disease, for example, like hepatitis, analyzed what are the different parameters which suggest that this patient is going to have a recurrence of the disease, how frequently is going to get hospitalized, what is his chance of developing a liver cancer, and so on. We can now predict all these things because of the ability of AI to look at large amount of data and come to this conclusion. So this is another area where predictive medicine, in fact, we can actually look at the patient's genomics, estimation of all the genes the patient had, and genomic medicine and genetic risk prediction is the next big thing, because in about 48 hours, I can take your blood sample. In 48 hours, I can look at every gene in your body, tell you this is your genetic composition. We have machines now which are extremely good at this, and I can take your genetic makeup, look at different combinations and tell you, for example, that if you drink alcohol, you're likely to get pancreatitis. Some people are lucky, if you drink alcohol, you won't get pancreatitis. So we can predict these type of things. Of course, for social reasons, we don't do this, but now we have the ability to do this based upon your genetic profile. So this predictive medicine and genomic medicine is going to become very important now in future. So the other thing is patient data and diagnostics. This is very important because what is happening in all of the hospitals now, we have, in coming to Indian hospitals too, we have very good electronic medical records, EMRs, and hospital information systems, which then take in everything here. For example, every single data point in every patient coming into hospital is now captured in EMRs. And based on this, we can use this patient data for several types of diagnostics that's coming up. And of course, this can be used for telemedicine and so on. So this is an example of patient. And clinical decision making. This is again, you thought that a computer and artificial intelligence system cannot make a clinical decision of what to do in a particular patient. But this is changing. Earlier, when we had a difficult case, say 20, 30 doctors used to sit together, the surgeons, physicians, and so on, and tell, okay, what shall we do in this patient? This is changing now. As a single person, I can get into ask AI now, what should I do? I get the collective opinions of not just 20 doctors, but 2,000 doctors to get what to do in this patient. So I think clinical decision making because of AI is going to become very evidence-based, and it can predict outcomes in many of these patients very well. So all these are, I think, things that we can. So these are the 4 pillars of how AI is going to be used in medicine now. And so, an example, I've had this patient recently, a skin lesion. You show to all our dermatologists. They said could be this. Dermatology names are very big. Actually, it turned out to be an early skin cancer, which using AI, the first diagnosis we got was skin cancer of that variety of skin cancer. Whereas all the big dermatologists miss this, and this neural network identifying skin cancer has now become a part of routine diagnosis, and is believed that because of this, dermatology practice will disappear in a few years' time. No more dermatologists. You just put your phone onto this, your smartphone, click and say what is the diagnosis, it will give you the diagnosis of the skin condition. That's how far it's going because it's so easily visible. I'm a gastroenterologist like Ravi here. What we do is put in endoscopies, watch lesions. I'm struggling to say, is this an early cancer in the stomach? Should I subject this patient to a big surgery because I have a doubt? The biopsy also is not very sure. So I want to be very sure. I want to be 200% sure. So because now we have what is called optic, actually predict that this small lump you see is a very, very early cancer, which I would have missed otherwise. So this is actually computer vision system that's coming in AI in a big way in medicine. So as endoscopies, we see inside and tell. From the skin, you can see outside, so you don't require any instrumentations and so on. So this is how AI is. And pancreatic cancer detection, imaging. For example, this was the image of a patient who came to us. He's been coming for last 3 years. Some pain, abdomen, vague symptoms, we missed. Now, when we did the CT scan, we found a lesion in the pancreas, cancer in the pancreas. Unfortunately, at this stage, it's not operable or not curable. We went back, he's getting CT scans done last 3 years in a hospital. We went back to the first scan 3 years back, which was done, put AI models on him, and found that AI actually got the cancer 3 years back. If we had used that, then we could have saved the patient's life. This is how AI is going to dramatically change how imaging. For example, you don't require radiologists to look at chest X-rays and say normal, abnormal. CT imaging everything can be now read by AI much better than what doctors can do or radiologists can do. So I think AI is going to play a huge role in medicine. I just showed you a few examples here. And I think the next future also is going to be mobile health and AI. All of us wear these watches, smart watches, which tells you a heart rate, which tells you. I've got many patients who have come to me saying I had some irregular heartbeat at one point of time. And then you see that when you actually look back, there's a small arrhythmia there. We correlate, you're having, at that point, the patient was having little wine or too much coffee or was in stress. This came up. Now you don't have to actually, you get all this data on the phone, you don't have to think about what triggered it. The AI is going to tell you on the phone itself, look, you're having too much wine, your heart is becoming irregular, kindly change, stop, for present or for some time. Integration of AI is going to come along with mobile technology, mobile health in a big way. I think that's going to be the future, very near future. We already have it. In fact, Apple is very strongly working on several of these models. They presently have the capability to detect physiological changes in the body. The next thing is to put AI. It is very easy to say why this is abnormal, what you should do to prevent, say, a potential heart attack and so on. And this is very, very near. Next 2-3 years are going to get this. In fact, we already have this now in some of the systems where we're using this. A patient in an intensive care unit is being monitored, cardiac monitoring done. All the time you can't have a good cardiologist or a intensivist there with the patient. So it develops a cardiac arrhythmia, which if it left alone for 3 minutes time, the patient can develop cerebral ischemia, brain death. But AI is detecting this, and the patient also has another syringe of medicine which actually blocks this arrhythmia, cardiac irregularity. AI instructs this syringe to be pushed into the patient, the drug goes into the patient, and it reverts back to normal rhythm. This is already happening. So this is something which is again going to come very next few years, and part of it we are already practicing in medicine also. So AI is going to get integrated into all our mobile health monitors. It's the next generation healthcare, as we say. The problem is that one of the things that we as doctors are supposed to be very empathetic to the patient, listen to the patient, I think have what is called good bedside manners. And the fear was that artificial intelligence or artificial intelligence robotics, you can create many of them, but they can't show the same empathy, the same feeling to the patient. But strangely, a recent study which was published, I think it's been publicized in many papers also, a recent study showed that when the patient called back to the hospital, it was a randomized trial where they compared the doctor answering and being empathetic to the patient versus a computer system which had artificial. And they found that the AI computer system was more empathetic to the patient than a doctor. So the last advantage we had as doctors is gone. They seem to doing a better job even there also. So just to summarize, we have AI role in prevention. It can tell you what lifestyle changes you should do, the exercises, diet and all. This has become standard now. Many very advanced wellness clinics are starting to use this. They take your basic data. We also have a large wellness clinic in AIG where you're using this, take it, and then you can actually give. For example, it doesn't mean that everybody drinking alcohol is bad for him. There may be, for some people, a little benefit also. So you can actually, smoking we know is universally bad. We ask them to stop. What is the sleep pattern? We know that sleeping pattern, amount of sleep changes from person to person. For some people, sleeping between 10 to 4 is good for the metabolic system. So from some people, it's 12 to 6, which is better. So all this can be mapped out in AI. How much exercise, whether you should do a morning exercise or an evening exercise and so on. We can do diagnosis, a lot of data interpretation of all labs. I get 100 of lab tests done sometimes. Now, how do I take these 100 lab tests and try to put them together? Very difficult. It'll take me a day to do that. But with AI, in few minutes time, the lab interpretation, your LFTs, your liver function test is like this, your kidney function test is like this. Maybe you have a disease of hepatorenal syndrome. I get the diagnosis immediately. I don't have to go through all the things. And of course, for treatment, the AI is going to be extremely easy. And follow-up. We know which patient should come after 1 month, which patient after 6 months, which patients. All this can be decided by AI. I think this is going to be a major change. And it's believed that the big data analytics is projected to yield about $300 to $450 billion just in US alone. And look at the whole market all over the world. It's going to be huge. But there are challenges. AI is not just all simple. There are challenges of the first important thing for AI is pure data. The data that we generate many times in many of our hospitals is not very accurate. Pure, accurate data, large amount of data is very important. There's trust, ethics, and so on. These are very important because we don't have proper regulatory bodies in our country. Not only in our country, all over the world, this is a dilemma now. There was, for example, a recent example of American hospital where AI was using for colonoscopy. The doctor doing colonoscopy missed a polyp, which later on became a cancer. So the patient sued the hospital saying the doctor missed. The doctor said you can sue the AI company because artificial intelligence company actually missed it because it's in the system. The courts were confused. Whom do you blame, the doctor or the AI? Finally, of course, they put the blame on the hospital and the doctor, and the AI was paid. But these regulatory things are going to become important. When something goes wrong, whom do you blame? Is it the AI? Is the doctor? A plane flying with the AI system crashes, whom do you blame? The plane, the pilot, or the AI system? So this in medicine is going to be a big dilemma now. And also the ethics involved is going to be a big problem. And let me tell you now, this is going to become a major problem because recently, for example, all the data from All India Institute of Sciences was hacked by, we think, a foreign country, we don't know where. And all the health records of all the national leaders are now with them. They know which minister has what problem this foreign company has got. And what has happened is that we are now controlling, for example, this is another example that happened, that in Germany, there was a very important Russian leader who was put on a ventilator. And of course, AI systems, now we use a lot of AI systems to control the breathing of the patient using these artificial respirators. The Russians hacked into the ventilator, and they controlled the breathing of this agent. So this can happen. So medicine is the danger area, and you see how there are pros and cons of using AI. Better data-driven decisions, treatment time is cut. There's a huge unnecessary hospital visits are cut down, but there are also some concerns. Concerns are, of course, as I told you, all this. Plus, our staff are becoming increasingly, difficult for us to ask them to adapt to AI. About 2 or 3 years back, if somebody came and told me, administrator, that you should use this AI methodology in the hospital, I would have been against it. Now I got convinced. To convince the senior doctors especially is very, very, very difficult. So this is also going to be another problem for adaptability. There's a concern that there'll be unemployment and doctors. That's not true. But I think one of the important things, and this was actually discussing with Chowdhury just recently, that for us, the major advantage we have in this country is the data. Huge amount of data. 1.4 billion health point data. Can you imagine? No other country can have this except China probably. And this data is a strength. If it's a pure data, integrated, put into AI systems, it's going to be a major help that's there for us. And I think this, of course, we are better at this, saying that the whole AI is going to add 15 trillion to the world economy. And the greatest impact is going to be in health field. AI in health is the future. I think for any startups, this is going to be. So the first century was steam power. The 19th century was mass production. 20th century was computing. And 21st century, I think, is the century of artificial intelligence. And of course, it's very important that we adapt. If we don't, like Charles Darwin said, it's not the strongest of the species that survives, but the most intelligent, the one most responsive to change. In fact, in 2009, if you look at how traffic was controlled in the United States and other places, they used to have these helicopters taking pictures, delaying back, telling you, don't take NH19, it's packed now, take another road. And in 2019, it's been replaced by drones. As 10 years later, replaced by drones, as you can see here now. No pilot is there. In just 10 years, the cameraman and the pilot both lost their jobs. And this is going to happen to people who don't adapt to AI, especially in healthcare. So that's the reason why at the Asian Institute of Gastroenterology we started this Institute of Artificial Intelligence, where we now have engineers from Google and other places along with our doctors working together to create what we believe is the next step in medicine. In next 5 years, the practice of medicine is going to dramatically change. And the major part of this changes are because of artificial intelligence. Thank you once again for giving me this opportunity.